Welcome back to Root in and Love. I'm Jason Loxamana with the St. Joseph Fund. Today, you'll hear a conversation between Amy Huang and Dr. Amy Stiffarm, Director of Native American Initiatives at Healthy Mothers, Healthy Babies, Montana. Dr. Stiffarm brings a grounded, honest lens to the tension many of us feel, the urgency to act fast, and the reality that sustainable change requires capacity, trust, and safety, especially in work shaped by long histories of harm and extraction. This episode explores what cultural safety can look like in philanthropy, why community stories and data must remain in community hands, and how funders can change internal systems to ensure partnerships are truly healing centered.
Hi, Amy.
Hi, Amy.
Hi, I am so honored today to have this conversation with you. And I think it is a pleasure to always be in a space with you because I learn so much. And I hope the St. Joseph Fund community will also have the pleasure of learning from you and also learning about our um, development in our partnership with you and the work that you're doing. So I'm really excited to be in the conversation and just to show the world who you are and how what a blessing it has been for the fun to build in partnership with you and continue to learn with you. So welcome, Dr. Amy Stiffarm. If you can do a introduction, that would be great.
Yeah. Oh, that's so sweet. I feel really lucky to be here too. I feel really lucky to be working with you and have your support in just the different projects we do. To have somebody, I don't know, it's just so nice to have somebody very open and that I can be like, hey, this is what's going on. So anyways, I guess before I get too much into it, my name is Amy Stiffarm. I'm an Aani tribal member from the Fort Belknap Indian community in North Central Montana. I also am Chippewa Cree and Blackfeet, so all Plains Indian tribes, all um, reservations in Montana, and so super. Montana is like one big family to me, it
Mhm.
feels like. Um, and I am currently the director of Native American initiatives at Healthy Mothers, Healthy Babies, Montana, which is how we first got to know you. I was
Mhm.
um, really grateful to be able to do help create, along with Western Montana AHEX crew, Chelsea and Drew, the Native American Maternal Health Community Advisory Board. It's something like our state has never had. And so being able to have that group and convene them with SJF support has been just so amazing and just feel like sometimes I got to pinch myself that we get to do the work we're doing. So happy to be
Mhm.
here.
Oh, thank you. I want to go back to when we first met. I think you alluded to this, how when we first learned about the work that you all are doing, we actually received a proposal that you all submitted from actually another funder local to the Montana community. And so I want to bring us back there at our first meeting when we were getting to know each other and we were all sitting in that space. And then we brought up capacity building, remember?
Hmm.
Uh,
I do.
and we talked about how the fund is focused on building up capacity building for organizations so that it will lead to community power building. I just wanted to uh, reflect together at that moment how
Mhm.
capacity building resonated with you or not at that moment
Mhm.
and how that has evolved in our work.
Yeah. Oh my gosh, I remember it. Yeah, I was kind of like capacity building, like we gotta go, like we gotta go
Yeah, I
right now.
remember that.
There's so much work to do, and um, just my background, I have had the privilege, I guess, of like having a lot of mentorship from folks doing similar work. So, like Indigenous, maternal, infant health, projects and whatnot throughout Indian country, like at a national
Mm-hmm.
level. So learning from Washington, Alaska, um, Minnesota, like what being able to like be in rooms with those people and hear about the work that they're doing and being like, they're reporting out on what they're doing, like thinking back to like 5 years ago. And I'm
Mm-hmm.
like, yeah, nothing yet, like just we're talking about it, or like there
Mm-hmm.
hadn't been a lot of movement. And then so um we had just created the Native American Initiatives program like not long before that meeting. And so I was very much in more of like a and I catch myself a lot being in like this sense of urgency of like, we have the roadmap, we know what they did, and we gotta go. Like there's people, families in Montana that need support, and we gotta go. And as we've been doing this work, and now we just finished like year two with the
Mm-hmm.
CAB, our community advisory board. It's been so refreshing and like such a I don't know, like not even a reminder, because I think it's just a whole new learning moment and
Mm-hmm.
approach to being like, okay, it actually, we can what does it look like when we're approaching work in a more sustainable way, when we actually have a foundation and we're not just like, grasping at straws, or, trying to like find band-aid solutions?
Right.
Like, what does it look like when we are taking that time to
Mm-hmm.
capacity build? And I remember like sometime this fall, we had a conversation where I was like, I get it. Like, okay, I was not aware of, and I think like capacity building, like it even maybe even sounds boring, right? Like
Right.
what does that mean? Like you're waiting to fill up the gas tank or
Right.
something. Um, but there's so much growth. Like there's still
Mm-hmm.
work and there's still growth
Mm-hmm.
happening. It's just more of a phase than the
Right.
like you're still going and moving on something, but it's not like go, go, go. And then when it is time to go, 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 you're
Right.
more prepared and you have more information, more knowledge, more people, more resources. So
Mm-hmm.
it was a hard thing to wrap my head around at first, but now that I'm in it, it's like, oh yeah, like please everybody give us time to build some capacity here.
Mm-hmm. I think for the fund, we really appreciate the behind the scenes work. I think the process work that happens, and it's like a lot of that muscle and movement work that nobody really sees and sometimes don't even honor. Because I think sometimes we're so fixated at the end result or the outcome, and that's great. But I think as part of our process, we learn so much, and we look at the opportunity to build and also activate and formulate things. And I think that it has allowed us to also build up our lessons learned, not so focused on being perfect, but what are we learning in the process? And I also have to say that being in this journey with all of you, we've also have evolved and learned. And so one of that is also looking at what this capacity building looks like for us as a fund. And I think we've approached our work more towards a healing centered capacity building. And what does that look like? It also means providing more spaciousness. It's also looking at where can we provide support in building up the capacity for the partners that we're working with. And so I want to also say thank you for all the partnership and all the insights that you have given us as we are looking into continuing growing and expanding the definition of what capacity building looks like. So,
Yeah. Yeah, no, I mean, it's such a important point, because I think a lot of times, and especially in this world of like, trying to get funding and funders, like it's like what it tends to focus a lot on like the optics, and like
mm,
for like working with Native communities where we try to be more critical of like, okay, is this performative, or
right.
and so really taking that time, like it's the inside work that is actually going that needs to change, but it's also going to make the biggest difference. And so,
Right.
it's different when you can say, oh, look at all these deliverables that I like fumbled through, versus look at how ready we are to address these issues. And I think yeah, it just makes the work more impactful
Hmm.
when you are operating with a full tank, right? And
Right. Right.
a lot of times what I see us doing in our work is like we're trying to help set up like healing spaces and make
Mm,
things like adjust deliverables and adjust grants so that we're able to provide like some
right.
sort of like healing, like whether that be environment or type of training for our communities. And what capacity building does, it's like, okay, well, let's make sure people in leadership positions or people who are doing this work that they're healing as well, because
Mm,
we can't operate from an empty cup.
yeah.
I mean, you can, and we have, but it doesn't, it affects the work. And so
Hmm.
being able to have that time and space to really work on the internal workings of your group and yourself, it makes a difference.
Hmm. I think one thing you said is performative. We've also seen from the funder side, from the philanthropic sector, that there's a lot of moments where tokenizations might have happened, right? Or
Mhm.
we are actually using stories that don't belong to the funders, and how do we uplift and amplify the work of our partners without being performative? And that is something that we're continuously being very cognizant of, but wanted to learn more about what the storytelling and what does honoring native knowledge mean to you, and how can funders we be better, because we're always talking about how are we collecting impact, right? How are we measuring outcomes and success? And I know we really want to ensure that storytelling belongs to our community partners, and we're all oftentimes trying to find different ways, creative outlets to support that storytelling through different types of mediums. But wanted to learn more from you, like what does that look like as we come into partnership between a
Mhm.
funder and a community partner?
Right. And I'll be honest too, it's something that we're figuring out because we were like, especially with funders like you, we were kind of feeling that room and that space to be um more transparent, or like to ask for more of what we need, and to say, wait a minute, let's think this through, because there have been so many projects or programs maybe in the past where that's just how it's done, right? It's like you're
Right.
just expected to do this. And so we kind of, I feel like, just learn to navigate through it.
Mhm.
Um, but working with you, Amy, and your group, it's really been, um, I don't know, like so refreshing and so healing, safe to be able to say, hey, this is something we have noticed in like these grant agreements, like
Mhm.
have you seen that, or have you heard of this before, or what would it be like if we said this? And so
Mm.
um we don't always have that, we're just kind of like, you get what you get, don't throw a fit, like just try to make it work for your community. and
Mhm.
and especially around storytelling, because and like reporting things, because a lot of times, if I'm we're very lucky to be a nonprofit, like, and to have Native American initiatives within HMHB,
Mhm.
where we're a program completely focused on working with Native communities in Montana. But we were created a few years ago within this nonprofit that has been going on since the 80s. So there's a lot of
Mm.
sustainability there. Um, but we have a statewide focus. And so we, a lot of times we work with communities directly. And so how we use our funding is to do work with different communities.
Right.
And so when it's like talking about our work, we have to be very careful not to share
Hmm.
the community's story,
Yep.
because that's not our story. Our
Right.
story is how we helped and how we were able to. So sometimes we're like a conduit
Right.
for to get resources to um, where they need to go, to the people doing the work who don't have like the time or the want to start a nonprofit to like receive funds directly. I mean, I think right
Hmm.
now, especially when we're looking at maternal and infant health, like um, there's just the community readiness isn't, that hasn't happened. There haven't been a lot of folks who are like, oh yeah, we're going to do this work here in our communities. And so it's been really fun to see how we can help and how we can help
Hmm.
grow that work, sustain that work, and using our mentors and our resources to help that. So I think
Hmm.
it becomes very it's even more um, it would be worse if we were as Native people doing that to other
Right.
Native people of like being
Yeah.
performative and being like, oh my God, look at, all this work we did in this community, where it's like, no, the community is leading these efforts and we're helping them however they want, however we can. Um, but it's not always our story to
Yes.
tell.
Hmm.
And that was something that I thought was pretty cool to come across and kind of reach out to you, be like, hey, how do we say, first and foremost, that whatever information or work we do belongs to the community, like not
Yep.
even us as the entity
Hmm.
receiving the funding for it, but the community has that ownership.
Yep.
And it was just refreshing to be able to talk about that.
And I really appreciate that there was so much honesty and so much transparency throughout our conversation, because I think, like, maybe I'll backtrack a little and provide some context. Is whenever we provide an agreement, there's this boilerplate, and it's like language that we think it's very much standardized, it's normalized, and it's a lot of legal jargon, and it's a very mundane part of the process. And sometimes we're not even thinking about the power of this language and what it holds and what it means, to people that are reading it. And I'm glad that you actually came and say, hey, there's an opportunity here where we can identify language that honors community knowledge. And you actually told me about, hey, there's data sovereignty. And I really appreciate that learning opportunity, because it's something that we do on a daily basis. It's a very mundane, process oriented work. And I think just that allowed us to think, wow, like this is an opportunity where we can internally change some of our systems and processes in terms of even a grant agreement. What does that look like? And how do we also share that systems wide? Because this is just like a blank boilerplate that we've just been using. But these are like some of those things that we can inch towards, to becoming better, when we really want to talk about being rooted in community, rooted in love, rooted in community wisdom. This is what like that beginning of changing some of those systems look like, that has not been helpful, that has not been benefiting communities of color and marginalized vulnerable communities. And so that is something that I really appreciate. And I think it talks about the relationship building that we had prior, for us to
Mhm.
get to that point. Um, so,
Yeah. Yeah. And you really brought up, I think that really kind of hits on the need for the healing, because we've always, I mean, just like you said, it's been standard, it's been so normalized. And
mhm,
we, especially Native communities, I feel like we've been like, and this is something like I studied in my PhD program, who was really looking at like how often like initiatives and like different things are just like pushed upon us. And it's like, this is what everyone else is doing, or this is what worked here. So now you guys go and do it. And
right.
we're like, just, grateful for the resources a lot of times, because we are so underfunded and have been systematically ignored and erased and whatnot. And so I think that all comes back to just that trust building.
Mm-hmm.
And it was very evident when we first started each year when we start the cab and we have new members and whatnot. Like everybody is like, well, what's the deliverables? What do we got to do? Like
Mm,
we know we're very like the almost like trauma that is there about knowing that it can't like feeling like we don't have that autonomy
right.
or to be able to define what we need and define what would be helpful to our communities, use our expertise. We kind of are already being like, well, what do the funders need? What do they need from us? And then we're gonna like do what we need to for our communities. And so it was a very seeing just how many other people who were leaders who we were bringing into the community advisory board throughout the whole state
Mm-hmm.
all were very like shocked and kind of had to be talked down a little bit of like no for real like we get to set like say what we need and then that's what we're going to do, that's what we're going to work on. And it was really refreshing and really healing. And you know, you mentioned data sovereignty and that's that's why it's so important, because if data is so powerful and if we're collecting data or reporting data and we're not understanding who that data actually belongs to, we
Mm-hmm.
can cause some real harm. And that's how
Right.
things have always been done.
Right.
And so
Right.
it's such a time, like a pendulum shift of like, hold on, we actually don't have to do things that way. Like, hold on, what if I just asked this funder who I trust, right? Of like, hey, what would, like, do we have to put that there? Or what can we
Right.
do to ensure that we're protecting communities' data? Um,
Mm-hmm.
because yeah, it's usually like it's almost then the kind of relationship isn't as deep. It's not it's
Right.
performative, right? It's like
Right.
we're going to perform the
Transactional. Mm-hmm.
deliverables that are asked of us, but we're really doing this deeper work here with our community, but we're not going to let you know that because you might try to take it or something, you know? It's
Mm-hmm.
just there's a lot of trust
Yeah.
rebuilding that needs to happen, and that, you know, I'm really grateful to be in a relationship like this with a funder who is not only okay with it, but like supporting it and asking what else they could do. So,
But at the same time, it's like you all are supporting the field of philanthropy to change our culture, right?
yeah.
Because for me, I didn't come into the field of philanthropy. You know, I've done nonprofit work and always loved community organizing work. And then coming into the field of philanthropy, I also had a notion of, oh, this is how it should be. This is how the grant cycle is. But as you're in it, you're able to unravel and unveil like, oh, why are we having processes like this? You start to question who made this process up? Why are we communicating with our partners in this way? Why do we have to collect data in this format? Why does it have to be like this? And so, if it's not for partners like you all, then the field will become stagnant, right? And so I see our work as part of a full ecosystem. And so how are we constantly shifting our practices and our work together so that it can become even better, become even more healing. So I think that's why I'm very appreciative of you, Amy, and the work that you all are doing, because it not only challenges us, but it also is a co-creation process that we are hopefully advancing the field together, and so that we can continue to steward our resources in a more equitable way. Um, I also wanted to, put in another learning opportunity that I had through you is besides data sovereignty. The first time that I heard cultural safety is from you and also from Chelsea. And so I also know that you wrote about it, and I was gifted this, and I have to show it off. I don't know if we can see it here,
Oh,
but this is authored by you.
mhm.
And in it, you talk about the cultural safety practices for working with Indigenous birth givers in Montana. And
Mhm.
you talked a lot about cultural safety. And I wanted to learn more from you. Like, what does that mean? Because we've heard so
Mhm.
much about cultural competency, right? Cultural
Right.
responsiveness. And what does that look like? And I know you said it in a clinical setting way, but what can cultural safety look like between partnership building, between building, between nonprofit and funders? Does cultural safety exist between these relationships? So just curious about what that looks like and how can we support cultural safety?
Right. Well, it looks like this. It looks like our discussions and our relationship, and that um even the fact like the work that we're doing is also changing systems, and
Mm,
that's so important. And cultural safety, I talk about it a lot with in the clinical setting, and I do a lot of cultural safety trainings across Montana with a lot of different labor and delivery units and all these
mm,
different urban hospitals that for Native families when they're having babies and stuff, they a lot of times have to leave the reservation. And so making sure that the places where they go understand about cultural safety.
mm,
And it's a very different term and different way of how kind of again how things have always just been done. Um, I first learned about cultural safety in the Indigenous Health PhD program from my instructor, Dr. Nicole Redvers. And she is from Canada, and they do a lot more, and they're more advanced, I would say, than I mean, I think anyone would say that who does public health work with tribes. Pretty more far advanced as far as the work that they're doing with tribes and the healing from the history and all of the negative outcomes that come from things like federal Indian policy and the what our ancestors have been put through, and really like how that distrust has
mm,
has been created. Like it is well deserved mistrust, but it's also not personal. It's these systems as a whole. And so when we first learned about cultural safety, it was very much in this mindset of like, okay, cultural competency just isn't enough. It's
mm,
important, but it's not enough. And so when I
mm,
think of cultural safety, I think of all those things like cultural sensitivity, being sensitive, cultural competency, like learning about other people's
mm,
cultures. But when we're talking about cultural competency, and a lot of times the issue with it, how we're looking at it is, oh, okay, I'm taking this cultural competency training and now I'm competent. Like it's a
mm,
static state.
right.
Um, and then you're ready. You're ready to go like work in tribal communities. And not only that, it really like reduces culture
Mm,
down to like actions, behaviors, and it's so much more than that.
right.
So it is important to try to understand the culture of the people who you're serving, but there's more that we could be doing. So with cultural safety, what I really appreciate about this work is it that's safety is the main goal, right? We want
Mm,
people to feel safe, to be safe. And so
mm,
when we're talking about cultural safety, it's really about creating this space, creating this environment where people feel safe, feel
mhm,
respected, and that they're not who they are and what we experience like isn't being challenged. Like
mm,
it's not, and a lot of times that's what kind of happens to us. It's like, well, was your doctor really discriminating against you, or were they just busy? And you're like, well, I don't know, maybe, or
mm,
you're kind of questioning yourself. um, so that's what's important is really like in a culturally safe environment, you're really creating that space where someone feels that they can be who they are and still be safe and respected. And it really translates across everywhere, not just clinical settings, but to health or to workspaces, to
Mm-hmm.
education, all of these. And the other thing about cultural safety is it's action, right? So
Mm,
cultural safety is we're gonna have this awareness. Like that's important. We need to
right,
understand, have this awareness about this power dynamic. Like, why wouldn't someone feel safe when they come in
right.
to access healthcare or
Mm,
when they are meeting with a funder? Why would someone not feel like they could be who they are? So that takes a level of understanding. That takes a level of commitment to knowing where these power dynamics come from. And a lot of times that's like
mm,
understanding the history, these different
mm,
historical contexts, but also maybe cultural context of why these power dynamics occur. But awareness isn't enough either. We
right.
have to take action. So, in a lot of the cultural safety trainings that I do, we take time to critically reflect. And it's not
Mm,
just a one-time thing. Like we're teaching people, we're planting seeds to get people to stop and think about, like you were saying, wait a minute, why am I doing it this way? Why do we do it this way? Does it need to
right,
be done this way? It's like, where did I get that belief from? Why do I think
right.
that? And then the other thing is addressing those power dynamics, then reflecting and changing behaviors of yourself and
Mm,
of your environment, the system you're in. Um, and most importantly, it's really up to that person. They have the power to say, you know, I act this isn't safe, or this actually wasn't a safe interaction for me. So you kind of, it's up to them to, if they feel safe or not, then it's culturally safe. It's not like,
right,
I created this culturally safe space for you, you should feel safe.
right,
It's
right.
really shifting that power back.
Mm,
And yeah, it's a lot of different things, and it's not like a one time, it's an ongoing practice. It's doing what you can with what you have, and then again planting seeds. Like, how do we, cultural safety isn't just for the labor and delivery nurses or your
right.
midwife or your OBGYN. It's for the people who are answering the phones, the people at the
Mm,
front desk, the people in leadership. Like everybody needs to understand why cultural safety is important and like be on board with that commitment to making your
mm,
space culturally safe.
mm. That was so beautiful. Because as you were talking, I'm reflecting back on how do we bring cultural safety into the funder world
Mhm.
as we are partnering with different communities.
Mhm.
Um, and how does that look like when we are addressing those power dynamics, right? How are we addressing that as funders have created, um, you know, this pattern of trying to take ownership
Mhm.
of creating power over when grants are being given, what that focus area is, and sometimes what those deliverables are, and what that scope of work looks like. And so I think it's a reflective opportunity for people in the field and beyond.
Mhm.
What does that look like to provide cultural safety? And like you say, it's a continuous journey, it's ongoing, and it is active, and it's
Mhm.
not passive. So I really appreciate, your continuously inspiring and also giving us all these knowledge as well. Um,
Mhm.
and I just wonder, what does that look like for us in 2026 now that we're in a new year? And I feel like we have a lot of energy and a lot of momentum, coming also from the advisory board. What
Mhm.
does that look like for us this year?
Mhm.
And I'm coming from a perspective that we are very excited to continue this partnership, to continue this evolvement. But what does that look like for you all this year? What's on the radar, and what's the priority for all of you?
Ooh, well, yeah. Um, it's been really cool to see the growth of the individuals in the cab. Like we've been really focused on that, like we're committed to that capacity building. And this past year we did things like a growth fund for them.
Mm,
And so it was they were also very much like, wait a minute, like this is for me. And they were all trying to like start a project based on this, like, not very much money to do a whole project for your community. And we're like, no, it's for you, like to invest in yourself. Like, what do you need? And um, like we had one of our Indigenous doulas who had been asked to like give trainings and stuff, and was trying to make slideshows on her phone because she's amazing and can literally do anything. But we're like, this would be a perfect opportunity for you
mm,
to get yourself a laptop, girl, and like people being like, oh my God, well, I've always wanted to do this training. Now I can. Like, it's just so hard. I think um, when you are a Native person, and you kind of
mhm,
like a really common goal for or value for Native people is like that reciprocity and that um responsibility to your community and to the collective. It's like we're always trying to take care of other people. And so having that permission to be like, or having Chelsea there to remind you, like, no, this, you're spending this on you. Um, it was really just, it felt good to see them get things that they need. And
mm,
so I think we're gonna, continue to do that, like just being able to support them because they deserve that and they're
mhm,
helping us. They've also expressed wanting to um, be able to like, hey, this is what we're going to bring in and we're going to learn about. They want to create more um, partnerships. And so it's really like we're kind of starting to see that like branching out. Like these
mhm,
roots are really rooted and like we're getting that, we've worked on that strong base. And now they're like, okay, now what else can we do?
mm,
And it's been really refreshing that it's them. Like we're not saying, no, 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 like don't do that, or do what we want to do, or this is what we thought you might do. It's really like or even pushing them, like you guys got to branch out, you got to branch, they're taking it upon themselves and um expressing to us. And I think even just creating, we were talking about cultural safety earlier and how
mhm,
you create that for them to be able to express that to us, like makes us feel good as like conveners. And then
mm,
knowing we can, because that's the one thing we don't ever want to do, especially as Native people, is say, hey, dream big and what do you want to do? And
right.
then say, okay, well, but actually, this is what the funding says we have to do, right? Like,
Mhm,
we don't want to do that. And so being in
right.
a position where we are able to tell people, like, well, what do you think your community, what do you need to serve your community? And then us be able to help them get there. That's really special. And it hasn't always like I keep saying, it hasn't always been the case. And so I really see the cab kind of starting to branch out a little bit more and wanting to even do things like communicate to their tribal council. And
Mm,
it's
mhm,
different. It's every community. And that's, I think, another thing that not everybody understands. Like, we're all different reservations in Montana, and then there's urban areas in Montana, but
right.
the needs of Native people aren't the same. Like it's so unique and based on the community. And so being able to have that flexibility where we're not saying, okay, each and every one of you are going to do this one same
Right.
exact thing, where it's more like, okay, what do you think would be helpful for you in your community? Um, and how can we support that? So yeah, I
Mm,
think it's kind of like it's like I know we're going to be branching out, and but it's really ultimately up to the cab, and so I think I'm just as excited and anxious to see how that looks as you are.
yeah, we're really excited, and we're really eager to see what this branch will look like and how it will formulate and how these branches will, intertwine with each other.
Mhm.
I think for me personally, maybe this is selfish, is that we have other partners in different states. And I talk about our partnership a lot with other folks in different areas, including Washington, which
Mm.
you also have a lot of connections there. And so I think as we're talking about branch, I would hope that one day some of our partners in different states, we can all come together and have peer learning, peer
Mhm.
exchange, sharing of knowledge. And because I have the privilege of meeting and connecting with so many different beautiful partners, that I think it would be such a beautiful situation if we can bring people together to celebrate the joys and the learnings that's happening in different areas. Like you say,
Mhm.
different communities have different needs. We're not a monolithic community at all. But what are
Mhm.
certain approaches or certain ways that you all navigated different challenges? What are those learning opportunities? And I see that opportunity for us to share your wisdom with some of our other community partners in different areas. So that is a selfish uh, 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 outlook I have for this new year. And I hope that those
Mhm.
branches will continue to grow and we will continue to connect and find different ways to, maybe from those roots to, maybe flowers or buds that will bloom. So thank you so much, Amy. Really appreciate our conversation, and I'm so happy that this is one of the best conversations I had in the year with you. So appreciate it
Aw,
so much. Thank
thank you.
you.
Yes, so excited for 2026.
Yay.
Happy to be here.
Yay. Happy New Year, everyone.
Happy New Year.